you ready to go?
I just need to change my shirt.
I'm Todd. I have MPA. That's short for microscopic polyangiitis. That's a mouthful, isn't it? Dr. Lewis said that MPA makes my blood vessels swell. That makes it hard for blood to move through my body. And since my blood carries oxygen and nutrients, some parts of my body can get less than they need. Some people have GPA. That's short for granulomatosis with polyangiitis. That's even a bigger mouthful. Dr. Lewis says GPA makes your blood vessels swell too, and makes it hard for blood to flow.
Thought you were getting ready.
Oops, almost forgot. We're going to the clinic today. I need to take my music and a book. If you have MPA or GPA, you know what it's like. We can get nosebleeds and our eyes can get red. We can get rashes, our joints can hurt, and our fingers or legs can lose feeling. We can have trouble breathing. We can take medicine that hopefully helps us feel better though. Nobody knows what causes MPA or GPA. I'm going to the clinic because I'm in a clinical research study. At least 25 kids with MPA or GPA from about 20 centers around the world are in this study. They are all ages, from 2 to 18 years old. We are helping researchers. They want to test an experimental drug, rituximab, in kids with MPA or GPA. Rituximab is used to treat people with cancer and arthritis, and it helps adults with MPA and GPA. So they want to find out if it's okay to use in kids. That's the reason for the study. So it might help my MPA, or it might not. The study is called PePRS. That stands for Pediatric Polyangiitis Rituximab Study.
I'll be waiting in the car.
Come along. I'll show you what it's like to be in the study. Well, here we are. Dr. Lewis and the nurses tell me to ask questions when I'm here. I ask a lot of questions. Just ask my mom. The study lasts for at least 18 months. The doctors and nurses want to see me a lot during the study. After I had 2 visits and was accepted on the study, I've come here once each week for the first 4 weeks. This is my 6th visit. Then I don't have to come as often. 13 visits in 18 months. They want to make sure I'm okay while I'm on the medicine, and for a while after I stop taking it. And they want to see if anything about my MPA or anything else about my health changes. At the visits, Dr. Lewis listens to my heart and lungs. I have to be quiet now. A nurse checks my blood pressure, my heart rate, and takes my temperature. They collect some blood, not too much, from a needle in a vein in my arm. I give them a little bit of pee in a cup. They test the blood and the pee in the lab. On the days of my visits, I can't have food, just water, until after the blood is collected. They ask me and the person with me at the visit if I've been sick or if I'm taking other medicines. I get to ask questions too. Dr. Lewis, am I saying this right? Rituximab? At the initial visits, they give me the rituximab. That's 1 dose each week. Rituximab is not a pill that you swallow. It's an IV drug. IV stands for intravenous. That means into your vein. Do you want to see how it's done? The nurse sets me up in a comfortable chair, and the rituximab goes drip, drip, drip into my vein through a tiny straw. This is called an IV infusion. It doesn't hurt, except for a pinch from a needle when they insert the straw. The IV infusion takes 4 to 5 hours. I watch a movie, read a book, drink some water, listen to some tunes. Someone from my family can stay with me. The nurses check on me a lot and come by just to talk too. It's not too bad really. At home, I take a pill every day called a steroid to help my MPA. We then make a note in my medication log each time I take it. After the infusion, we go home. My next visits will be shorter since I won't get the infusion anymore. That was just for the initial 4 visits. I'll have health checks and lab tests at the rest of my visits. I bet the dog's waiting to go out. What did I tell you? They ask me about side effects at every visit, and they tell me to call if I feel sick or something hurts. Some people have a fever or chills during the infusion. This especially happens with the first one. My family and I talked about the study before I joined. Dr. Lewis told us about it and then let us decide. We said yes. It might make my MPA better, but it might not. The study can help doctors learn more about how to treat MPA and GPA, so maybe it can help other kids who have these problems. No one has to be in the study, and anyone can leave the study at any time. So that's all there is to it. It's not so bad, and you get to ask a lot of questions and learn stuff. Do you have any questions about the study? If so, ask your family or your doctor. Well, gotta go. Someone's been waiting for me. Good doggy.